Good afternoon, everyone. Thank you for the opportunity to present our proposal to help strengthen our health profession workforce and advance the health of Kentucky. And we've been doing that through our HCATS programming, which stands for Health Colleges Advancing Team Skills. And this proposal is to bring awareness right now to address student mental health and wellness. Transforming our workforce and promoting health in Kentucky starts right here with our students. The University of Kentucky Strategic Plan centers around 4 pillars for student academic success. Our proposal can impact all pillars, especially health and wellness and belonging and engagement. Through a partnership with the UK Centre for Interprofessional Health Education, the UK College of Agriculture, and the UK Counselling Centre, we propose a 3-part training series. Training will help promote self-awareness about mental health, raise mental health awareness, and help students learn how to support students with depression and/or suicidal thoughts by referring them to the appropriate UK resources. Today's challenges in higher education and the stress our students face require different strategies to improve the UK student experience. Wise academic leaders, wise learning environments listen to students, and our students will tell you straight up. Just this year, we heard from students about how the university needs to improve the support for basic needs and address concerns brought forward by the Black Student Advisory Council. Also this year, we heard the tragic news about losing 2 of our University of Kentucky freshmen to suicide. This is not just a concern or a fact at the University of Kentucky, it is happening all across the country. Every year, the American College of Health Associations conducts surveys about the health of students, and the data continues to be alarming. The most recent survey of 88,000 college students reported depression being so bad that it is hard for them to function. They feel overwhelmed. And 5% say they self-injure. That's 4,400 students intentionally cutting or burning themselves. We also know that 400 physicians take their lives to suicide. And hot off the press, the first study ever in over 2 decades reported nurses, both female and male nurses, are taking their lives twice the rate of the general population. Looking closer at the University of Kentucky, we know health profession students can be more significantly impacted with mental health issues than other college students. That is because of the rigorous programs of studies that our students face, and also the fact that many of our students cannot always optimally heal or help their patients, and lack of awareness of help for students on the health side of the UK campus. A recent survey of 206 of our nursing students at all levels, all undergraduate levels, 85% of them said they were not aware of the 20-plus resources at the UK Counselling Center, and 75% said they did not believe the university was placing student mental health as a top priority. In a different survey this spring, over 100 nursing students, they are actually now seniors, revealed some startling information. So let's see, Michael, if we can pull up that video. Michael's going to get it. We'll take a pass on that video.
combination of how you feel about yourself, the world, and your life, your ability to solve problems and overcome challenges, your ability to build relationships with others and contribute to your communities, your ability to achieve your goals at work and in life. The UK College of Nursing students and faculty would like to share with you an example of the challenges faced among our students in seeking help for addressing their mental wellness.
Please stand up if you have ever felt in the past year excluded, isolated, or not part of a group. Felt homesick or lonely? Felt anxious or stressed out? Felt sad or depressed? Felt overwhelmed? Felt less than or worthless? And lastly, please stand if you have ever felt embarrassed or afraid to reach out to others.
Are you able to pull the next slide up, Michael? So that's hard for any dean to hear, especially hearing 73% of my own current
Being mentally well is not the same thing as being free from mental illness.
My
Just
own
because someone
current
doesn't have a diagnosed
senior
mental
class
illness does not
report
mean they're
sadness and
doing well or
depression.
coping well.
57% report being afraid to ask for help. 41% report that they feel worthless. Because all Wildcat student lives matter, we should and must do more for student mental health. We propose 100 students from UK's 7 health profession colleges, dentistry, health sciences, medicine, nursing, pharmacy, public health, and social work, go to the barn for a 3-part training series to expand university support and resources for student mental health and wellness. In Part 1, students will learn from and work with expert clinicians in the UK Counseling Center to assess their own awareness about mental health, learn strategies to destigmatize mental health, and learn QPR skills, which stands for question, persuade, and refer. This training will help students identify cues that someone may be at risk of suicide so that they can help them get professional help. In Part 2, students will learn from and with expert faculty in the College of Agriculture and learn how to promote self-awareness, effective communication, and gain confidence through Equine-Assisted Learning, also known as EAL training. In Part 3, students will integrate the QPR skills training and the EAL skills training by continuing to engage with expert University of Kentucky faculty and clinicians. The training would be capped off with farm-to-table talks for team building activities, debriefing, presenting cohort projects, and celebrating as Center of Interprofessional Health Education barn keepers, which will add strength to the university's student pool of QPR gatekeepers. For a little over $28,000, 5 cohorts of 20 students will engage in 10 hours of training and experiential learning sessions for an outcome of 100 barn keepers to advance the university's mission for a healthy learning and living experience at the University of Kentucky. Just like sunflowers, our HCATS to the Barn programming can help bring more warmth, positivity, strength, and happiness for our students struggling with mental health and wellness, and hopefully help to prevent another loss of life by suicide at the University of Kentucky. Thank you. So I'll be glad to take any questions that you may have. Yes?
As part of this, are there going to be students that are holdovers that can be the trainers for the next group, or is this a cohort that's kind of isolated and you'll always be starting over with people in the program?
Yes, that's an excellent question. So the way that we're building the program, it'll be looking at students their second year. So we'll have on their second year, so that way they can provide support their third year and their fourth year. So to answer your question, yes, there is that plan. So it's not one of those one and done impact factors. Although a one and done's pretty good for us with basketball right now.
Can you tell us a little bit about Equine-Assisted Learning?
Okay, so it's a phenomenal program that the College of Agriculture has had for a number of years, where our students actually start practicing communication skills with horses and those facilitators, the faculty in the College of Agriculture, where they learn about themselves, of some perhaps behaviors that aren't real healthy in work environments, working as a team with care delivery, whether it's their nonverbal skills or their verbal skills. Horses will let you know in a heartbeat that you're coming across too strong, or you need to be putting a little bit more encouragement in terms of the direction that we would like for our care delivery teams to go in. So it's pretty phenomenal to see the way those horses can help transform the lives of our students with their actions and behaviors.
Dr. Heath, help me with the math here. Is it
Oh,
20 students or 10
Let me get
students?
my cocktail napkin out if you're going to ask me math questions. So it's 5 cohorts, and in each of those cohorts, there'll be 20 students. So there'll be a total of 100 at the end of the entire program that we would be able to recognize and celebrate their accomplishments in the program.
So the 284.25 per student, that's the part I'm confused about.
Well, I definitely would need my calculator up here. So, yeah,
Okay.
sorry. And Carrie, if you want to just hand me I can pull my proposal out maybe. See what I did with my math.
And could you just give a little more information about the farm to table talks and
Oh,
how
yes,
that?
yes. So there is also another College of Agriculture faculty member in Family Environmental Services that is a nutritional expert, a clinical nutritionist. And she does this phenomenal exercise where she actually brings fresh fruits and vegetables, from the farms, and she brings the students together, and they're actually preparing the meal together. So it's a beautiful concept. It has worked very nicely in some other program that we've had. So we thought it would be just ideal to integrate that with HCATs to the barn as well. But they're actually, the food's coming from the farm, the students are putting the meals together, and they're talking about the success of their learning experiences and some of the outcomes that have come of that. I can see back to the math question, on that very bottom line, you got it figured out? Okay, good. Thank you for that. Oh, Lisa said I'm done. Okay, thank you all very much.